First of all, welcome everybody. Thank you for joining us today. I'm Chris Sundberg. I'm the Executive Director of Elder Voice Family Advocates and one of the founding members of the group as well. And I welcome you here. I'll go through this presentation and hit all the highlights. I intend to leave plenty of time for discussion and questions afterwards, and just to kind of keep a smoother process, we'll do it that way. Let me plow through the information that we have, and then we'll open it up later. Also, what I'm going to be presenting to you today is an overview of a much fuller report on the central Minnesota instances of investigations of long-term care providers in the central Minnesota area. And if you're interested in getting that full report, which will give you a lot more information on some of the facilities that have been cited here and some of the specific issues, please just give me a call at the number in the back, or go to chris@eldervoicefamilyadvocates.org. Sorry, it's such a long name, but the email address is what it is. Steve, go ahead and advance, please. As we're probably all well aware, the changing demographics is really coming upon us quickly. We're growing to be a much elderly population, and already our over 65 year population has exceeded the K through 12 population, and by 2030, more than 1 in 5 of the Minnesotans will be a part of this older population. Please advance. This graphic kind of shows you in a very descriptive way the population growth versus the supply of long-term care facilities. And we clearly have issues that are going to have to be dealt with down the road to be providing the kind of care that is important for many people, and providing the quality care along with that as well. Please advance. And I mentioned the quality care, and as we're seeing this explosion, really, and it is an explosion of the elderly population, what we're really seeing is how challenged many in the long-term care industry are right now. I know we've got 1 or 2 excellent care providers who are a part of this presentation today, who talk often about the challenges that they're facing. So this is something we'll all have to work on together, but we have to work on that together with a full and broad spectrum of information, and we will get there. Go ahead, Steve. When you take a look at this slide, you're getting a pretty graphic view of the explosion of the issues going on. And what we have seen in the last decade is amazing explosion of care issues. In 2010, there were only 4,000 cases of reported abuse and neglect. By 2018, that was up to over 22,000 cases. This is a 562% increase in the complaints. But keep in mind, as drastic as that number is, only 3 to 5% of those cases are really investigated on site, and then only 15% of the complaints are getting any kind of review. And so you can tell this is just a tip of the iceberg. then on top of that, not only of those 22,000 complaints that come in, national experts estimate that only 1 in 14 to 24 cases of abuse or neglect actually get reported. And there's lots of reasons for that. Probably lack of knowledge of who to report to, or intimidation, fear, whatever those cases might be, or just plain old insecurity. But these numbers are drastic, they're startling, but the real cases are far worse than this. Advance, please. And what we've seen with Elder Voice, and the reason we came together as a group, is because of some of the horrific neglect and abuse and maltreatment that we were all experiencing. And for myself personally, my dad had a horrible experience in a Sartell, Sauk Rapids, facility. And when I went to try to find accountability, found that there really wasn't any. And a small group of us got together and started to talk about these issues. And in 2015, we organized Elder Voice Family Advocates. And we organized not because we wanted to rail on about what happened to us, but because we really wanted to be a part of the solution and try to address these issues and hopefully make things a lot better for other people in the future. And as people started coming to us, I mean, the stories of what was happening are shocking. Limbs being amputated because wounds weren't being treated, really cruel abuse, both physical and mental abuse happening in some of these places. Neglect that is a shame to see, where people are left to suffer and get even sicker with time. Excuse me a minute. Also, one of the things that we were seeing is a lot of medication errors and a lot of medication theft. And I guess that's not too shocking because of the opioid epidemic. These kind of facilities are a very good target for people who have addiction problems. So we're seeing that happen. The medication errors are a result of poor practices in some of these facilities and sometimes poor training. To me, what was especially shocking is the number of sexual abuse reports. And it's amazing that this would happen, but it is happening. And there are several reports, including that of my left, for days or weeks without even being checked on. Advance, please. So what brings us to this is we did get funding from the Morgan Family Foundation to do this research. And what we did is just looked at the past 2 years of care providers in the central Minnesota area. And that was a 40-mile radius from St. Cloud. So that goes up, to the Monticello, Elk River, and further north and west from there. We went in this just to have a better understanding of what's happening, as well as to be an education tool for our the folks in the area. Please advance. And some of you may have noticed that this was a front page story in the St. Cloud Times on April 29th. And they actually covered the story pretty accurately. And uh, you can go to our website and get the full story if you're interested in seeing that. Please move on, Steve. As you can see, out of the area, there are 47 facilities investigated by the Department of Health in that 2 + 2 months time period. And of those, they were largely nursing homes and assisted living. There was a small number of home health agencies and some intermediate care, but by and far, the largest groupings were nursing homes and assisted living. Out of these 47 investigations, there were 89 complaints, actual complaints. So some of these facilities had a number of investigations going on. These investigations range anywhere from a page and a half to 50 pages long, depending on the complexity of the case happening, as well as the it appears, it seems, the investigator and their thoroughness or lack of thoroughness. Out of those cases, 47 were substantiated. No, 27 were substantiated, thank you. And 17 were inconclusive, and 45 were unsubstantiated. And now, we report on all of these, and the reason for that is when we take a look, especially at some of the inconclusive findings, and we've actually been told by the Department of Health personnel that most of the inconclusives really mean that something happened, but they just can't verify it. They don't have either photographic proof or some other kind of substantiation, or they get conflicting stories. So we have included that in the full report, and the reader can draw their own conclusions about each one of those investigations and the merits or lack of merits of those. Please advance. No, I just cite this because this was in the area, and you probably all saw the headlines. But this was an example of one of the really more exaggerated, the more horrific kinds of cases that were going on, and the Department of Health did the rare step of shutting down these operations. Please advance. Now, what we found when we looked at these, 23 of the investigations were for neglect of care. And that ranges from things to being left in bed unattended for, till noon or later, or being left in a wheelchair even overnight in some cases, or not being given food or water for long periods of times, or not being kept clean. I mean, it's a wide range of possibilities there. 15 of the cases were falls, and many of those falls were because in our review of this, either not enough staff, so people who required a 2-person lifts, there weren't 2 staff people available, so 1 staff person tried it and then a fall happens, or just careless procedures that led to these falls. 10 of these cases were abuse, and some of them were really pretty shocking. They're being verbally yelled at, being slapped and hit and pushed around, and these sort of things. And a lot of these folks have memory issues, and oftentimes behavior problems go hand in hand with that. But people who are well trained to manage those behaviors usually don't have any significant issues at all, but others aren't given that training perhaps, or don't have the mindset to try to address that. 10 of these were medication theft, and some of them resulted in arrest, others did not. And the concern there is that those who do not get addressed, they often they get fired from where they were at. But are they then just go down the street and get rehired by another facility? And we're seeing kind of those serial staff people, who go to these places because they're easy targets. Often these folks cannot speak for themselves, so it's very easy to steal their pain medication and the suffering that results. Because one person, for instance, had a pain level of 10 out of 10, according to the investigation report, and went for weeks without that pain medication. So you can imagine the suffering that that poor person went through. 9 of these were lack of supervision, and that is often, no management present to oversee what's happening and giving proper guidance to folks. Medication errors, like I mentioned, are also common. And again, there's a range of reasons for that. You have to have protocols and strict processes to manage those, and some of the facilities were found to be very deficient in that. 7 of the cases were actually sexual abuse, and I don't remember the number offhand, but most of them were abused by a staff person, and I think there were a couple of resident to resident sexual abuse, and again, those require special care and special oversight of those problems. Theft of money, again, these are easy targets to steal money from. And actually 2 of them, of the investigations, were actually the resident making some pretty poor choices that really resulted in some bad outcomes for them. Please advance. There we go. Okay. A lot of this is it's staff driven. Nearly everything, when you look at this, comes back to staff problems. Understaffing's been a chronic problem in long-term care for many years, and it really shows when you see when you take a look at these investigations. Also, communications is another common problem. It's amazing that a facility can get a new resident admitted from the hospital, and the care staff aren't even aware of it for many, many hours, something. And poor training is another chronic problem, and this is again, the good providers make sure they really take care of this and properly train folks to do the kind of cares that they are expected to be doing. And as I've mentioned, drug addiction is also really a common problem, and poor supervision. This is often either an RN who's responsible, or another staff person who has the overall responsibility for a facility, really not taking an aggressive role in doing that work and making sure that the staff are giving quality care, are giving the and have the training and can do what they're being asked to do. And in general, kind of just a lack of nursing standards. Our RN members of Elder Voice are constantly appalled at how poor some of these facilities are. Please advance. Uh, just to give you a couple of examples of what has happened with the substantiated cases. In one case, uh, they were treating for a fracture in internal bleeding, or they failed to treat for the fracture and the internal bleeding, left the person alone for 13 hours when they were returned for the hospital. So again, you can imagine the suffering that person went through. Uh, there was another case in one of the area facilities where the nursing assistant sexually abused, I think it was a couple of residents. That person was arrested, and I'm not sure what the outcome after that. But many broken bones and bruises and improper transfers that went on. Please advance. And as I've mentioned, medication theft. Four facilities had staff that were doing the stealing, and three of them were actually even nurses. So, and one was a home health aide. And typically, they would target several of the residents to steal from. And I had already mentioned the level 10 back pain that was reported. um, Again, some of them do get arrested, but we don't know their outcome. Uh, and we would encourage these facilities to pursue the legal recourse when it makes in these sort of cases. Please advance. Three facilities had preventable falls, and many of them, as I've mentioned, are a result of just understaffing or poor training. Please advance. I'll kind of go through these next ones a little more quickly. Uh, Theft of money, sometimes, nominal amounts of money, and other times larger amounts of money. Uh, in one case, unbelievably, a resident was left for an hour and a half on the floor, and the staff refused to pick her up. So but they gave the resident a blanket, a pillow, and a phone, and told them, "You call your family to come and pick you up." Um, so that's what that person ended up having to do. Another person wandered from the facility and was found in a marshy area. This was in November, and the person was gone for 2.5 hours. And the temperatures, as I've noted here, were 33 degrees during the day and 20 degrees at night. This person was found in time, but this could have had a catastrophic ending in this place. And I believe, if I remember correctly, that was a memory care person. Wandering is a common problem and requires specific uh, um, steps to take to eliminate this kind of risk. Please advance. 8 of the facilities that we looked at actually had 3 or more investigations, and I just arbitrarily picked that number uh, to indicate, the facilities that seem to have a great deal of trouble and have perhaps a systemic problem in some of these places. Uh, the Good Shepherd, Heritage House of Malacca, and Minnesota Heritage House each had 6. Uh, there were 5 in Talahi Nursing and Rehab, 5 in St. Benedict's, 3 Meeker Manor, Edgewood, Sartell, and Acumen Hospice. Interesting when you see these 8, 4 of them now have COVID detected in their facilities. So the chart here is not accurate. The other, Talahi, is also another one with COVID, and St. Benedict has also now had confirmed COVID. Please advance. Well, now we've got COVID-19 on the scene, and what's happening is we're really seeing an exposure of the systemic failures in many of these senior care facilities. And and keep in mind again, the risk factors are significant in these places. Typically, these residents are of poorer health. Just living in a congregate setting is a substantial risk as well. And additionally, infection control has been an ongoing problem in many of these places. And you have seen many investigations and reviews by the Department of Health where infection control practices have been subpar, and that was prior to the pandemic. So, no surprise that that after this we're seeing some drastic results. And the CARES is rapidly deteriorating, and it's driven by the staffing issues, which have been compounded. Staff are getting sick and not able to come in, or they're afraid to come in, or who knows, or they just can't find them to hire enough of them. Chronic lack of personal protective equipment, and we've heard this all over the place. And the frustrating part is that we don't see the same priorities being given to the long-term care facilities in terms of the state and the federal government making sure they have this protective equipment on hand. And again, the poor infection control procedures are accentuated right now. Additionally, there's no family visits, and that's it. A lot of family actually go daily to provide the added care and companionship, and now haven't been able to do that for the past 3 months. And there's totally insufficient testing of staff and residents, so we don't know what's really happening. Now, to make all of this worse is that there's very limited oversight right now happening. There's no families that are able to go and visit. Now, those guidelines are starting to open up a little bit, and that's a good thing. So family can be aware of what the situation, what the condition is of their loved one, and address any issues that they might see. Again, on the state level, the Ombudsman's office is not allowed to send anybody in to do an investigation and help remedy problems. They can only do this by phone, and as you can well imagine, that's a poor substitute for a visit. And then we don't have assisted living licensure. Again, Minnesota was the last state to not even license assisted living. Now, we were successful in getting that law in place last year, but the actual licensing is not effective until August 2021, next year. So we know there's a lot of harm going on. We're hearing a lot of reports, but we know there are a lot more that are happening, and the poor providers are getting substantially worse. Please advance. I've just highlighted a few of the facilities in this in the region I covered who have COVID detected in their facilities, and you'll note that there's a few here with the 2 stars by them that are actually receiving COVID hospital patients. And that's something we have serious questions about the wisdom of doing that. I'm not going to run through this list, but this PowerPoint will be available on our website afterwards, so you can check this out. But please advance the list. And there's a few more. So moving on. So here we are in this situation. 78% of the COVID deaths are happening in the long-term care facilities. And that's not just a Minnesota statistic. It appears to be, we're among the worst in the nation, but the entire country is suffering from this. And it's our opinion that ageism is a significant problem, and it's marginalizing the value and humanity of seniors and vulnerable adults. We often compare the oversight given of child care or pet care, veterinary care. They're far, far more aggressive than the oversight of the care for elders. It's time that we equalize that inequity going on. We've got special sessions now. There's another one planned for this coming Monday to address issues, and the threats that we are seeing are threats to what we accomplished last year in getting the licensure of assisted living. The Department of Health now has redeployed 90% of their staff to address the COVID pandemic. That is leaving an enormous vacuum of oversight in the facilities. Then to compound all this, the industry's coming to and asking for blanket legal immunity for the long-term care facilities during this pandemic. So not only do you not have eyes on in many of these places, when something goes wrong, there's very, very limited accountability, and there are attempts to try to make that far worse. We are aggressively working to remedy some of this. We're being told by the Department of Health that because of the pandemic, they cannot get the assisted living licensure work done, and therefore it will be delayed. They would like to get an approval by the legislature to delay that, but if they don't get it, they tell us it'll happen anyway. They just aren't going to be able to do it. This is hugely problematic because we are seeing so many of the deaths happening in these poorly, these facilities that have very poor oversight, and we need to find some solution. So the solution that we are pursuing are in Senate File 60 and House File 99. That was at least the bill numbers in the last special session. They will be different bill numbers in this coming session, but essentially what we're asking for is you have to have broad protections in place, especially during this period of time where there's no oversight, limited oversight, and there is a delay in the licensure. Please advance. So what we're advocating is much stronger infection control measures. We're advocating for much better protections from termination. We are hearing a lot of issues going on with some facilities terminating a resident for really no apparent reason other than to be able to allow in another resident with a higher compensation rate, either because of whatever. We're also advocating that we have a separation of COVID-19 positive cases versus the negative cases. Too many facilities are not adequately separating, and that's why we see some of the rampant infection cases happening in some of these places. Also, residents need to have their right to choose their care provider, and that's being denied in too many cases. And electronic monitoring assistance would help a great deal for those who aren't able to enter the room of their loved one, but at least be able to monitor the care given and monitor whether there's a sudden change in condition, that they can call the facility and alert them that something needs to happen. And then I think importantly is the creation of a task force of healthcare experts. And we're asking that this really include a broad range of not industry people, some of them, but it needs to be more heavily weighted to the healthcare expert, infection control folks, those sorts of people, as well as the family representatives. Family often are the last to be seriously considered. Please advance. Before I go into the slide, I would just stress to you, please check our social media and please check our website, because we will be giving updates on the status of this legislation. Please let your legislators know that they have to pass protections during this pandemic, and believe me, it went a long ways in making sure that we're here today, and that Elder Voice is actually the lead advocate on this issue. And we're talking directly to the Department of Health on a daily basis. I think this week has been every single day so far. So yeah, please help us by calling your legislators. Now, just a few, tips for those of you who might be looking at senior care facilities. Just be well informed. I know it's really easy for us to go into a place and see, oh my gosh, look at that fireplace, and look at the wonderful subdued lighting and the pool table, etc. Please look way beyond that. Key thing is staffing levels, and there really should be an RN or an LPN available 24/7 every day of the week. And then we recommend that no more than 25% are temporary staff. Please advance. Also, awake staff. It's amazing. We've even heard of some facilities who have no staff, yet alone awake staff. Make sure ask them when you're looking at these places, ask them these sort of things. We recommend a staff to resident ratio of 1 direct care staff for every 10 residents during the daytime, and evening hours, 1 direct care staff for every 15 residents during the evening. And again, we're seeing far fewer of that in practice. Please advance. Just some other questions, to go through when you're talking to the facilities. Who is their home care provider? And check around, ask others their thoughts about the provider that they have. Ask about their latest home care survey, by the Minnesota Department of Health. They should be providing that to you upon request. Check to see if they do background checks on their employees. That can be a really excellent way of screening, drug abuse problems or criminal problems, such as sexual abusers, and it's a possible safety. How many of their aides have completed the basic 8-hour training? very basic, but you'd be surprised at how many are hired right off the street with no training, enter and be told, okay, get to work. So, and what's the staff turnover? That'll tell you a lot. Problem facilities have a high turnover, and also, more full-time staff is a far better indicator of quality than it being loaded with part-time staff. And check on their wellness policy. You need to know what that is and how often your loved one is going to be checked. Please advance. And the care planning phase is critically important. So make sure you have a thorough discussion about that, and make sure that there is a professional assessment of what the needs are. And keep in mind that you as a family member maybe aren't the best person to really know at all times. Maybe you need some help from professionals in assessing their needs. And then I'll reverse that and just say the opposite. At other times, your insights are far better than what others are going to see. So be aggressive in that. Also, physical and mental and emotional activity is critically important to their overall well-being. And just make sure you get it in writing. All the verbal assurances you get are worthless. Please advance. And there are plenty of resources in the area to call, for help. The Minnesota Adult Abuse Reporting Center. Please call the local police if you have to. They're an excellent resource to help out during these times. The Minnesota Department of Health's Office of Health Facilities Complaints is a good resource for you. Your local health departments are another excellent resource, and the Minnesota Department of Human Services. Please advance. And don't forget the Minnesota Central Minnesota Council on Aging. Great resource for finding good facilities, and the senior linkage line as well. That information can be found on our website, or if you look at this PowerPoint as well. Legal Aid has a St. Cloud office, and when you're in a bind, use them, and it'll help you out. And of course, the Alzheimer's Association for those with memory and etc. Well, please advance. Now, with all this doom and gloom I've talked about, I really have to tell you, there are wonderful facilities with phenomenal staff, and thank God we have them. So please don't go into this thinking they're all horrible places. They aren't. And even places that have had issues, if they address them and change their practices, that's what you need. It's those who just refuse to change the practices that you have to be aware of. And just make sure that you're informed, and that you're taking the right steps and doing your due diligence. Also, I'll tell you, in a month, we're going to have another webinar, which is titled Ageism and Racism. And the tie to these two issues, especially during this COVID, are really striking. And we'll be looking at that in terms of the long-term care industry. We've got great speakers who are University of Minnesota experts and available to talk to you on that. And I believe that's August 6th, but you'll see that on our website. And with that, last slide, and I thank you for participating. And Steve, let's open it up to any questions or discussion, if there are any.
Most folks have been muted either when they came in or later on. So if you do have comments, you'll need to unclick that little microphone so that we can hear you. So please do feel free to share comments or questions, but in order to do that, you'll need to unmute yourself so we can hear you.
No questions, nothing from anybody. No
Maybe just a
comments.
little issue on the muting. I'm going to just go ahead and click through and ask everybody to unmute, so you might see a button, make it clearer. There you go.
There, that seemed to work.
Christine, I want to thank you for this information. I joined at the request of Bonnie, or the suggestion of Bonnie, and so it's more informational. At this point, my dad is still living at home, and I've been trying to provide some care by phone as different issues come up. But we did have good care when my mom needed it in our home as well. But very alarming information and helpful to, I guess, be informed and be aware of how others might need help.
Thank you very much. And reach out anytime. And there are, the more we get into this, the longer you can keep your loved one in the home, it's better, particularly right now. Anybody else?
Chris, while we're waiting to see if anybody else has a thought, there are some thoughts from Elder Voice Family Advocates about in-home care or other non-institutional care. Is the best place to learn more about that just the website, or are there other links you want to refer people to while they're still thinking about that mix of having in-home persons, especially if you've got non-family caregivers that are involved?
Yeah, I will, we've got one participant, Deb Taylor, and Deb's agency or organization, excuse me, provides a lot of that help. Deb, can you comment to that?
I can. Pardon the appearance here, working from home like many of the rest of you working remotely. Yes, up in the central Minnesota area, we do have services available. The website to go to for those services is seniorcommunity.org, and that will put you in touch with all the different services that are available to help keep older adults in their own homes, in dignity and safely, safe from the virus. And also we are also focused in keeping those folks that are staying at home connected to their communities as well, which is no easy task right now. But we're making great progress there as well. So visit our website for those types of services. The other available resource is for family caregivers themselves. Oftentimes we, as caregivers, sometimes feel kind of alone and maybe don't have all the support that we need. And that's where we come in as well. We have a licensed social worker in central Minnesota that can help with that. So I encourage you, again, to visit our website and check out the resources available to you. And if you have any further questions, feel free to reach out to me directly. And my number is 952-767-7897. Thanks, Christine.
Thank you, Deb. She's got an awesome resource there. Actually, we align well because our focus is after you're in a long-term care facility. Deb's focus is before you have that need to move to that kind of care. So thanks for attending as well, Deb.
Yeah, thank you.
Anybody else?
Ann Sterner raised her hand. Oh, there you go, Ann.
Hi, Ann.
Hi. Say, my in-laws are in a facility in St. Cloud, and you touched on some of the COVID statistics there, but like, with the limited visiting and all that, I was wondering if you had some recommendations on doing that and on keeping in touch with the situation in the facility.
Okay, I'm not sure. It's what are you asking for? So you
Well,
want-
I'm asking if we have guidelines about in-person visits. My husband and I went last week, and we were able to do it outside in their patio. It was very informal, though. There wasn't, nobody there. We could have taken off our masks if we needed to. There wasn't supervision, but that was wonderful that we did it. If you have guidelines or tips for us in doing in-person visits, and I'll keep the second part for after.
We do have that, and we have that drafted, and it's ready to post. And Jean Peters, who is our RN, also our president, helped to put all those guidelines together. So we'll get that posted in the next day or two. It's just going through a final review. The Department of Health is also posting some visitation guidelines as well. And then each facility is developing their own guidelines. And so you need to check with them as well about what they are allowing or not allowing.
Okay. And the second part of my question was now the facility has appeared on the list of having COVID, and I'm just wondering how do we keep tabs on that, or what other kind of
good luck is
yeah.
what I say to that. Good luck, because the Department of Health is very reticent in giving us any data on that. There have been some data requests that we have been able to access. They only come out probably about once a month, something like that. But at least it tells you how many are happening. Because right now, when you get a list from the Department of Health, all you see is a name. You don't know how many, which really doesn't give you the information you need to have. And so we are encouraging more of them, but it's limited. Talk to the facility. A lot of them will be very open about it. Others are going to not be, and shame on them, to be honest.
Thanks.
And if somebody wants to comment, please do. Jean, unmute and go for it. Can you unmute her, Steve?
I can't do it from here, unfortunately. Jean has to select that. I can ask you to, so maybe there'll be a visible button, so it's a little bit easier.
Sure.
There you go.
Now it is. Now I'm unmuted. Now I'm unmuted. It was telling me that you had to let me, Steve. So thank you.
Sorry.
Yeah. In response to Anne, besides calling for information on the number of COVID cases that are in the facility, either prior to calling or after, or maybe both, follow up with an email. And the way that we are structured for assisted living facilities in Minnesota is the housing with services, which is basically the apartment building, and then the home care if there are certain things that are brought in. So my advice to you would be to find out who, number one, is the administrator of the building, and call and email them with that question about the number of COVID cases, what floor they're on, how many days have they had COVID, and that might help put you at ease. Just say if there's only one person in the entire building of 140, and that person has been staying in the room, hasn't really had any cares done, and is on a certain floor, that sometimes is comforting to have that information. But one really needs to contact the home care or the nurse, the head nurse, and then the facility supervisor too. You have to do double follow-up, and hopefully the assisted living licensure will improve that process. It's just so unfortunate right now that this is happening. Lots of worries for families.
Thanks, Jean. Other comments or questions?
Hi, say this is Bonnie. Steve, Chris, can I ask a question?
Please do, Bonnie.
Okay. Very nice presentation, Chris. Thank you. Say, there's just a comment I'd like to make, you know, with assisted living not being licensed now, you know, they are not obligated to do background checks on any of the staff that they hire. There are many facilities that will do background checks, but I think that's just something that you really want to ask when you are seeking, you know, a place for your loved one. The other thing too that Chris pointed out is, you know, look behind the pretty stuff. You know, some things that you can watch for is, you know, go visit the facility that you're thinking about when they're having lunch or when there's a little bit more community activity. You know, how are the residents dressed? What do their clothing look like? Are their glasses placed on their head and properly placed on their head? You can tell a lot by really observing, you know, how residents or tenants are in these facilities. That tells a story. So I think that's just a very good point. Look beyond the really nice, pretty stuff. Really look at the residents. So those are just two comments I wanted to make.
Thanks, Bonnie. And obviously, in a COVID environment, it's harder for us to do those kinds of in-person reviews, but by talking to others helps us also get a little bit of a feel. You know, the other thing too is believe what your loved one is telling you too. Sometimes, especially if they have memory issues, you question whether you're getting the real story here or not. So my suggestion is believe them first and check, you know. So others. Go ahead. Okay. Well, we are 1 minute away from our end time, so maybe with that we will call it a date. Please feel free to reach out to me. My phone number was on the last slide. Again, my email is chris@eldervoicefamilyadvocates.org, and you can just Google elder voice, excuse me, and it'll pop up either number 1 or number 2. So thank you, and I you know, welcome this. And if you have other organizations in your area that you think would be interested in hearing about this information, I'm happy to do another webinar for whomever. So feel free. Sometimes church organizations ask. Several civic organizations have also asked for this sort of thing. So we're happy to do that, and look forward to maybe a little deeper dive in the COVID issues in central Minnesota in the future. But with that, I thank you, and I appreciate this. So please stay in touch with us. Take care.